Beyond the COVID-19 pandemic is what's being referred to as an infodemic. So much information being made available that it's hard for some to determine what's accurate and what isn't. It's found everywhere online and even on the streets, whether it be in the form of protests or signs popping up everywhere in the city. Scattered throughout the city are the false messages to counter those from public health and medical professionals. Claims of people dying after getting the COVID shot, or that the media isn't telling you everything about COVID and vaccines. All this beyond what can be found online.
We actually know from before the pandemic that misinformation about vaccines has been linked to vaccine hesitancy and people not getting vaccinated. And so we know that social media and the internet, if you just do a search, you don't know what kind of information you're going to get.
Just last week, Statistics Canada reported nearly 2 in 5 Canadians have believed information they saw related to COVID-19 was true before realizing that it wasn't later. The survey also found that only 1 in 5 people always check the accuracy of online COVID-19 information. The Association of Media Literacy encourages people to approach information with a healthy dose of skepticism and check to see if that information shows up in more than one place.
This isn't just, which salad dressing or which pop am I going to be drinking? This is a much higher stakes situation. So that's why I should ramp up my own sleuthing, my own journalistic skills.
Personally, I would go to a source like the Center for Disease Control, something that is pretty squeaky clean in terms of the science. I wouldn't necessarily go searching on my Facebook feed.
Rallies arguing against government safety measures and the need to wear masks have been held throughout the pandemic, including anti-vaccination efforts. Campaigns to counter those messages and vaccine hesitancy are ramping up as a result. The federal government just announced $64 million to help increase uptake, while local health units are simply trying to spread the word.
To use people like community ambassadors. In fact, we have some train the trainer sessions next week to get people who are in the community briefed on this vaccine.
All the while, the misinformation continues, whether it be false claims online or a sign posted to direct people elsewhere.
Does it concern you that public property is being used for this type of information?
I think if people find these signs, actually call 311. A lot of people don't know that we actually have sign bylaws and people that can actually help to take down signs that are not supposed to be there, that have false information.
For more information on COVID-19 vaccines and how to go about checking if the information is true, you can go to our website, citynews.ca/extras.